So inflammatory bowel disease is a chronic condition usually characterized by inflammation throughout the colon and can also actually go through the entire GI tract depending on what type of inflammatory bowel disease. So there's two particular types that we usually focus on, which is Crohn's disease and ulcerative colitis. So ulcerative colitis, as you can tell in the name colitis, it typically affects only the colon and it doesn't affect the rest of the GI tract. However, Crohn's disease is a disorder that can actually affect the entire GI tract from the mouth all the way down to the anus. The way that we diagnose these particular disorders are multifaceted. So we look at labs, we look at imaging, and we look at endoscopic findings. So typical endoscopic findings in someone that has very severe ulcerative colitis is going to be severe inflammation of the colon. They can have little erosions. They can look very, very red, or erythematous is what we call. Usually what we do to diagnose is get biopsies of the colon, and then we look at certain laboratory markers that will tell us that there's increased inflammation. Crohn's disease is kind of the same way. However, with Crohn's disease, you worry about it being also within the small bowel. So when we do an upper endoscopy and a colonoscopy, we only see the colon, and then we only see to about the second portion of the small intestine called the duodenum. We miss a multiple feet of the small bowel that the Crohn's disease potentially could be affecting. At that particular point, we would order some type of imaging, which is usually known as an enterography, to get an image of this to see if there are any strictures, any narrowing, or any inflammation in that particular area that could be suggestive of Crohn's disease in accordance with the other findings, the laboratory findings, and potentially if we saw anything on the endoscopic findings.